We are now meeting Strat. Yeah,
Aloha, Charlie Iona. How are you, my friend?
I'm doing fine, brother. How are you?
Good, man. Good. I know a lot of people saw the video come up for a little while and started posting away like, "What's going on? What's going on? What's going on?" We were just doing a test, and the test was successful. As you can see, we are back on Zoom tonight. Um, and just because we just had some technical stuff that we feel more comfortable with Zoom, so we'll be using Stream Wire or whatever that is as a backup. But we wanted to, because we got Dr. Miscovich on tonight, we wanted to make sure everything could go smoothly. We didn't have any glitches. So anyway, how are you, Charles?
I'm doing fine. I'm doing really fine. I just say aloha to everyone. I didn't make a video today. I was kind of like, not under the weather, but you got one of those blah days and there should be no reason for it. But I just kicked back, relaxed. It was just really muggy, really hot today.
Yeah, it was miserable today. Patsy and I went out and go deliver some shields, and at least got to ride, go to the west side. Was nice. Was Dr. O'Carroll is asking, "Where's the chair, Charlie? You know your big background."
How you doing, Dara? No, the wife said, you shall be a little more professional and not look like you're broadcasting from Chuck E. Cheese or Fun Factory. Put it that way.
Yeah, I'm debating if I should outfit my son's room, well, my son's old room, into a little office studio area. There, Dana Moore is asking, "Where's the big blue slipper, Charlie Iona?"
Well, Dana, sweetie, I killed enough 747s with one slap with that big blue slipper. So the big blue slipper is retired.
Hey, Dana, we want to get Dr. Yan on with that contact tracing app. So maybe you could reach out to her. I did provide the email. So yeah, let her know. We'd love to have her on the show to talk about that app. Contact tracing is in the news. It's
Oh,
constant. Um,
yeah.
I did want to say we lost a friend from Kauai today, just a few hours ago. My wife just got the text message. Obviously, I'm not going to release any names, but it's someone that from the west side, from Waimea, big family. Um, and tested positive. Everything was fine. He was feeling better in the morning, this morning, and he passed away this afternoon. And we had Sarah on last night, and I'm hoping that Sarah Bolus touched a lot of people last night, and I'm sure that now this friend is was residing on Oahu, so he wasn't living on Kauai, but he's been here all his life, and a little over 50 years old. And I guess what I'm trying to say is that this stuff is real. And Charlie, you got a dose of it early on.
Yep.
You got a real heavy dose, and we
Never
appreciate you
get
bringing
over it.
us along that journey. But you saw the reality of this early on. Until today, we still have people that don't believe that this is real.
Yep.
And um,
Well, let me say this, Mel. I brought everybody on the journey early on, and I thank you for inviting me on this platform. And somehow you think in the back of your mind that you're gonna get over this hurdle, but you don't, because um, I always said that my dad said, you don't need to be scared of the ghosts. You be scared of the living, because the living is the one that can hurt you. A ghost, you cannot touch them, you cannot see them, you cannot feel them, and that's one thing with this damn virus. It's invisible, and I mean, how do you supposed to fight something that you really can't see? So, ladies and gentlemen, that's the reason why this has been a personal journey for me, because I don't want to see anybody go through that. And more and more, you try to you try to fathom the thought that, okay, I got a loved one in a hospital, but you cannot be there holding their hands. You, I'm gonna tell you this from firsthand experience. After they cracked my chest open when I had my bypass surgery at Queens, the first person I wanted to be with me was my wife, and she couldn't be with me for that period of time when I was in the ICU. It's a scary damn feeling, let me tell you. And the nursing staff was so nice; they stayed with me around the clock, because that's when it's the most crucial time. Is that so many hours after the surgery? Because anything can go wrong. One of the grafts break, you start bleeding internally. You just scared, and I'm gonna tell you right now, I was scared, and all I wanted was my wife be there with me, but she couldn't. Just imagine these individuals with COVID; they cannot have their family with them, all the way up until the point that they pass away, if they go that route. Okay, if it's really bad, they may have a nice nursing staff that will kokua and bring their smartphone in and uh, FaceTime you folks. But not all the nurses can do that. They're busy. So it's just one of those things, brother. It's one of those things, man.
But it's like, remember when we first went to war back in Desert Storm, and we started losing troops, and then the whole country fell apart for our troops, and then it became common, yeah, troops
Hmm.
dying in wars, whether it was Desert Storm or any of the other, Afghanistan, Iraq, whatever. The number of deaths got so high that it was just a number. It was just a number. You would wait on the nightly news to see how many Americans died in some stupid war, but it became just a number because the deaths were so far away, and you didn't know these people. They were soldiers and airmen and sailors,
Yep.
and I feel that's the same thing with COVID. And as these deaths mounts, the cases rise. People still trying to say that this damn virus is like the flu. These people that are in it, I'm going to tell you, Charlie, I've blocked two people, and two people because of the personal attacks that they were making on others, not on me, on others. But I'm going to block people that are putting out this crappy information. Today, one of my friends posts a graphic about how dangerous it is to wear a mask. A good friend of mine. And I almost block him today. And but now with what just happened today, I don't know time for play with that kind of people. You have that kinds of opinions, keep it to your damn self. Because you see, you posting that kind of stuff out there, telling people to do what science has told us works. You're hurting people, you're harming people, you're putting people at risk. So, tonight after the show, bro, I'm gonna have probably about 5 more openings for friends because these guys are gone. Seriously, these are not just numbers. These are not just numbers. I hear people joking about the numbers and all of that. It's yeah, exactly, Leilani. Sick of hearing people trying to minimize the virus. No, it's not the flu. We're not. I'm tired of talking about the flu already. I thought we got past that, Charlie. I thought everyone realized that the number of COVID's deaths in half a year has surpassed the number of annual deaths of the flu. And we're talking about all the strains of influenza versus one COVID-19 virus. So anyway, I thought we got past that, but we haven't. People still talk like that.
You know why? For me, it's sort of like, nah. They talk about the flu. I told one friend, okay, you know, I know with a flu, I can go in Longs right now, buy one over the counter, take a couple days, licorice split, brand new, right? Uh, I told him, should I go down to CVS tomorrow? Try see if you can find something for COVID on the counter. Let me know. Just let me know. Then I'll let everybody else know. But right now, I cannot find anything over the counter. So I did want to say one thing. Today, I'm so happy for a good friend of ours. We had him on, Brian Ingalls. He completed his course with the John Hopkins University on contact tracing, uh, and he's taking his other course of virology, 50-hour course. I'm so proud of that guy. You know, at his age, doing all of that. But I got to take a look at some of the contact tracing courses, and I even though I come down hard on it, but boy, I see a lot of the contacts that need to be made and some of the stuff that I didn't know. So I'm even appreciating it more. But just by looking at it, there's like some one person get like 50 to 60 something steps they got to go through. I don't know if you got 20 people and you do the math, how many steps you have to go through just to contact a group of people, maybe three or four, then you have to repeat that process with those people. I can see why it's very, very tiresome. And this is not an 8 hour job. This is not an 8 to 4 job. I mean, if you're gonna get yourself into contact tracing, you better make the commitment that you're going in the office and tell your family, yeah, I might not come home to 12 midnight because that's what it's gonna be. I'm being serious. It's not the kind of like, oh well, dinner time's almost up. Okay, gang, go to the rest of your office staff and say, hey, I see you guys tomorrow. No, no, no. Because when you're contact tracing, you know, anywhere from 6 to 10 hour window that you got to try to beat, and that's how Korea does it, and they do it very, very successfully. And I just have this utmost respect not for contact tracer, but just based on math involved in numbers, I don't know how they do it. It just doesn't pan out. I'm pretty sure they have a system. What that system is anybody's guess right now.
Yeah, Brian Ingalls will be our guest next week Friday. By the way, he will be our guest next week Friday, and he's going to share with us, a lot of interesting information and topics, and I'm looking forward to Friday's conversation. But going back to our system in Hawaii,
Yep.
where because they had so many cases, they were told to prioritize only work on cases that involved people that were aged 65 or older.
Right.
We lost a person the other day that was 44.
Yep.
Dr. Green said he was 44 years old. Today, 52. All of these cases that they tested positive in the Hawaii system did not get traced. Now, um, that's like really stupid.
Hmm.
Uh, how can how how can you not how can you put a restriction like that? Sarah last night for 35 years old. So in other words, and yeah, we understand that was back in March. I know there was a lot of as I went over the post after the show, I saw a lot of people asking why weren't the family tested. Remember back in the beginning, back this was back in March that she got sick. Who knows when really when she got the virus, but when she tested positive. Remember back then, you almost had to have had all the symptoms.
Right.
Remember, you had to have all the symptoms or you wouldn't get a test. So you know, I, that was the explanation. But now it's a little different. Um, but my point is this: if you are a positive person at 64 years of age,
You missed the cutoff.
yeah, you, sorry, your contacts are not going to be called, and that is, I don't even know if there's a word for that. Not stupid, but irresponsible.
Yep.
Yeah, George Ma is also very young. I mean, we know. Okay, so that was all the myths. If we could do a show on all the myths of COVID-19, that would be the first myth, right? Well, the first myth was, well, you cannot pass the virus unless you have symptoms. And then don't worry, it only affects people that are old or very old and have underlying conditions. So if you was old and you was healthy, you was safe. There were many myths. And now, as we're 5 months or 6 months later, we know a lot more, and
Yep.
it's a good thing. But anyway, tonight's guest is Dr. Miscovich, and he's in the waiting room right now. I'm going to bring him in. In fact, I'm going to bring him in, and then I'm going to say what, because I want him to hear what I got to say about Dr. Miscovich. So let's bring him in. Oh, there he is again. This is the sideways doctor. He's the sideways doctor.
You want me to go this way?
The other way.
There you
How's
go.
So,
There you go, Scott.
yeah, that's a nice shirt.
Ren Spooner. I'm a Ren Spooner guy, man.
Well, you know, I gotta tell you something, man. I was secure. No, that shirt is what the people at Timbers Resort uses. I should go grab mine. Oh, I may have turned it back. I don't know, but they wear that same Ren Spooner.
Nice. Yeah, and I'm a Ren
shirt.
Spooner guy. I like Ren. So, yeah.
What is the best thing you like about Ren Spooner?
I like the how heavy the material is, and you know, it doesn't all bunch up and doesn't all wrinkle in here and everything like that. It remains its shape. You can wear a Ren Spooner 3-4 years, man.
Without ironing.
That's by far. Well, wait a second. I don't have a freaking iron, and I'm not pushing my wife to iron. That's for sure. Don't worry. Yeah, that's exactly right.
Ren Spooners, man. That's all I have in Aloha shirts is Ren Spooners, believe it or not. Yeah. But anyway, we're not gonna waste no more time, Doc. I want to thank you for being on. I wanted to do the introduction while you were here so you could hear me, because I got to tell the public I saw you on Tulsi Gabbard's press conference yesterday, and I saw a different side of Dr. Miscovich. Well, Charlie and I know Dr. Miscovich when we talk off camera, but even then, what I saw yesterday was someone that felt he needed to inform and educate the public. Much kudos, and I'm going to let you tell the story, but that whistleblower did an amazing thing yesterday. And this goes back a long way, and I'm not sure how much you can reveal, but anyway, Doc, I just want to welcome. I want to welcome you to our show, and I want to welcome you and thank you for always being so responsive. I can tell you that we already have 272 people on this call. They've been waiting to hear from Doc. They don't want to hear from Mel. So, Charlie, any words for Doc before we turn him loose?
Oh, they don't want to hear from Charlie, so turn it over to the Doc.
All right, Doc, fire away, buddy.
All right.
What's been going on?
Well, yeah, like I said to you when we were texting earlier, you know, not much going on. Maybe we're going to have to talk about sports or something like that. No, what a time we're in right now. I mean, you guys know, and once again, thank you guys for all you're doing to keep the public informed. And thanks to all the listeners for, you know, all the support they're giving you guys and the people who are out there standing up. And kudos to the big Kauai group of leaders with former mayor and some of the docs and a lot of the chamber. They're really, I'm actively following them, and they're standing up doing the right thing. All right, where are we right now? What's our problem? Well, the reality number one is the disease is out of control on Oahu, plain and simple. It's not getting better. It's not going to just get better with just saying, hey, wear your masks, or, you know, closing bars down. Yet, on the other hand, restaurants with bars are still open, or, you know, yeah, we closed the beaches down, but beach is the place we should probably keep open, because as long as people would socially distance, you can go to the beaches. So from my perspective, and you guys have heard me say this now, for the last 3-4 weeks since I've been with you, probably when we started to see the surge, shut it down. And Oahu specific right now needs to be stay at home, work at home. I have no problems with all the neighbor islands staying open and continuing their, you know, being conservative and trying to do. And I concur with what your mayor has done, and actually some of the other mayors. I talked to Mayor Victorino yesterday for quite a long time, and we're regularly working with Mayor Kim on the Big Island. I'm working directly now with all of Mayor Caldwell's people. We have a big drive-through down at Kaka'ako tomorrow. And so, you know, I'm still doing my thing, which is working through the mayors, because, you know, God knows I don't get any kukua from the state, except, you know, I look over my shoulder to see if I have hitmen that are chasing me down the streets that are being sent. So, Yeah, so right now we're in a challenge. We are in a challenge because we are still surging towards our ICUs closing with beds that are just being overrun. I'm getting a lot of direct feedback from the medical community. You know, we have a internal closed hui of concerned docs that we share information, and the admissions that are going on and the number of people that are showing up both at the emergency rooms, the admissions that are going into the hospitals. By the time they show up in any numbers, it's down the line. We're not getting a lot of real-time information. That's what the public has to understand. What you're getting today is probably something that's coming from early, last week, and the number of people that are sitting in the queue right now waiting to be admitted that are part of the real problem. Those are going to be, you know, showing up sometime next week in the data. The other thing we need to understand is this disease is very, very, very predictable now. To understand the data we have now with the positive rate of infection is already projecting what 10 to 14 days will look like. So it's still going to surge. You know, so that's why I'm tired. You saw yesterday, people are dying. People are dying because of failures at the Department of Health. And now I'm going to point the finger, failures by our governor. It starts with leadership. And after I saw his response of protecting the lies that came out of Bruce Anderson and Sarah Park in the Department of Health, and then he has the nerve to be calling the senators out for why are they challenging? Has he once said to us and looked us in the face and apologized for the numerous times that he was telling us we have hundreds of contact tracers? Now, you don't have to tell me that, oh, he was just listening to Bruce and Sarah. Fine, but he's the chief. He's a responsible person. They lied to him. He turned to us and he sat in front of a camera numerous times and talked about how great the contact tracing program was. Has he apologized? Has he accepted that? No, he's just had his spokesperson put a little spin on it and say, oh, well, you know, we're now going to do better. Yeah, no, trust us. We're going to do better. We have a new person that's put in. Or who's the new person report to? They still report to the governor. They still report to Bruce Anderson, who's still there. And, you know, the contact tracing, you still have the same people behind the scenes. We're just not going to see them sitting in the briefings anymore, but they're still behind the scenes pulling all the strings. Things have got to change. People are dying. You know, that's the big problem we have. How do we deal with this? So I'll stop there and let you guys throw some things in because, as you can tell, I'm past the phase of just calmly discussing this. I'm to the point where when I hear the people of our state are dying, and they're dying because of negligence, which is gross negligence, and we are being lied to, it is time to stop. And it's time for the people to ask for change right now.
Doc, how much can you share about our whistleblower? We saw her on camera yesterday. It was very obvious that she was emotionally suffering. I mean, when she spoke of there was one point where she broke down and her body was physically shaking, definitely, you know, struggling from this. But how much can you tell us about what happened? How this all happened? How did the whistleblower come forward?
Yeah, it's open information. And so, as I mentioned in the press conference about a month ago, I think my dates were a little bit off, she called me questioning some information on a patient that she was doing contact tracing on, and we provided information to her. She called me directly, you know, because the Department of Health has my cell phone. They can call me anytime, any hour, anytime, and she got on my case. She just kind of, you know, she was not afraid to just rip me a new one, and she was saying, oh, you know, I need to talk to you about something else. We're all working really hard here, and all you do when you get in front of the media is talk negatively about the Department of Health. And I'm like, no, I'm not you. I mean, you people are, I'm sure there's wonderful people down there. I'm talking about the direction and the fact that the Department of Health is contrary to the rest of the world. They're doing things that just make no sense whatsoever. And we need to not let people die, and we need to do what the world has proven works. And, it went back and forth. After about 10 minutes, then we got to the point where I started asking her about herself. This is one well-educated lady. She's got a PhD in virology, and she has tons of epidemiology training, and she's worked in high-level respiratory contained labs. She studied coronavirus before. And when I got to this, I just started to go, wow. And then we transitioned in where I started asking her questions, and she started to explain to me different things about how some of the machines that are being used to test for corona are calibrated. And I was like learning, and I was like, wow, keep telling me. And then we transitioned into the stress. I could hear she was like, gosh, I prepared my whole life for this, and now I'm doing this, contact tracing and epidemiology, infectious disease, and I would like to help more. And we left it at that. Then, as I said in the briefing, a couple weeks later, I get a call from her. I left her my phone number. I hadn't talked to her since. I had never met her until actually, first time I met her was yesterday at the press conference physically. And she called me in tears, and she was like, I didn't know who to call, but I'll never forget it. She just said, we're being lied to. The people of Hawaii are being lied to. I can't sit back and let it happen anymore. And she went on to tell me all about the fact that there's only 10 contact tracers, and that these numbers that are being given are just outrageous. And I first have to say, I vet my sources. You guys know when you're in your roles as law enforcement, you always have to look at the source that you have. And the more you talk to her, you could just tell by watching her in the press conference how legitimate she was. And then she texted me over data, and it was a very well done spreadsheet with the names of the contact tracers, each month, how many cases they had, the total number of cases, where. And I was like, wow. And then she sent me a secondary form. This is all while we're talking. We stayed on an hour and a half. So I went ahead and I did reach out to the lieutenant governor and let him know what was going on. And that was while I was on the phone, and basically left her with the idea that she needed to be given whistleblower immunity, that I encouraged her to come forward. And it took a while just for her to think about coming forward. She was almost thinking maybe she'd turn it over to someone to do something. And I said, no, you are the source. You need to do this. You are the key to this. And got her hooked up with Josh. And then the process went where Claire Connor got involved. I also encouraged her to get involved with her union, because I've done more than my share of working with union grievances and know how important it is to have dual track investigations going. Then the union got her, and the union got other people in her office. And, and from that point on, I was texting her, talking to her almost every day, because one of the things that was palpable that day was she was having a nervous breakdown, which she admitted to in the press conference, because it comes because she cares, because she knew that she couldn't do her job, and she knew that people were at risk from it, and she knew that the state was being lied to, and nothing was being done to help it. And then I started to throw some side comments to try to get our senators involved, and I encouraged her and gave her specific senators to reach out to, which then led to, was it a week ago Thursday, we touched enough senators and got them the information that there was a private behind closed doors, the COVID committee had a whistleblower hearing. And so she had 2.5 hours with them. And that's why when the following day they showed up at the Department of Health, they had just heard crystal clear what the truth was. And that's why there was a lot of like, okay, what's really going on? And then the rest of it flowed from there. And then we got to the point where at the same time before the Senate hearing, I was just concerned that if we just let it, I knew what we were going to get. We were going to get this circuitous spin from the Department of Health, and the governor was going to sit and come up with something that his spokesperson would write, like, no, we got it all covered. Trust us, trust us. And that's when I reached out to Tulsi, because, I've developed a strong working relationship with Tulsi, and she really does care about what's going on. And I've been very impressed with her. And I lit her up with this whole process. And, oh man, I will never forget when I told her all about this, and I started sending her the documents on a phone call. She was livid, and oh man, she was breathing fire. She could not believe that we were being lied to. And so then she took off and made everything happen like we had yesterday. She pushed it forward. I was talking to her every day. She was talking to Nancy Pelosi. She was talking to the head of the Senate Health Investigative Committee, and that led to yesterday. And I continued to talk to Jennifer, and was just getting an update. And also we broadened it out for me to be talking to her about the health and safety of her coworkers, because these people working 60, 80, 100 hours a week, knowing they got no support. Now, here's one thing I don't think came out. When she gave me the whistleblower comment, right, and I first started to have the meeting, never, zero, had any of them ever seen, met, talked to, or had a meeting with Sarah Park or Bruce Anderson. In the entire pandemic, they never came and spoke to the contact tracing team. I mean, that alone, when I heard that, was like, oh my God, what is going on here? As we hear over and over and over again about how great contact tracing is, and you have the nerve to sit there and look in the camera and lie when you even know you can't even go walk up 2 doors down and talk to your people, say, hey, how you doing? How's it going? What's going on? Tell me about what's happening. How are the people of Hawaii doing? Come on, this is lives. This is just ridiculous. And so last Friday, I felt so bad for him. I sent down 40 sandwiches and sent an entire lunch down anonymously and said, thank you. We appreciate all of your hard work, and encouraged. And I think we had a couple more organizations join me and started to send some lunches over to them so that they know that we do appreciate them and that people care. So that's kind of the summary of where we are right now. And it's she's a hero, because she stood up and went way out in the line and put her. You saw how emotional she was, and I've heard her in tears numerous times after days when we had the 300 day or something, and she's getting 40 new cases. And guys, as your role as law enforcement and the jobs you guys have, how do you call 40 of anything? How do you trace 40? I can't even clean up 40 times my dog goes to the bathroom in the yard in 2 days, let alone think you're going to chase people down on a cell phone or something. I mean, it's just impossible. And then each one of them has so many people. And we've been lied to. It's just abhorrent.
And Doc, that's where I wanted, and real quick, Charlie, where in the heck did they come up with these changing numbers at every report? I mean, the numbers change. I think Tulsi graphically exposed that, but I mean, were they making it up? Did we even figure that out? 100, 450 on standby, 170 today. Their numbers just never did jive. Did we figure out how they came up with those numbers? Did they explain that at any different? If there was any other meetings that we didn't get to see?
No, never.
Tulsi said it's just made up.
Yeah, it's just made up. And then you guys have seen these conferences. Look at what we're dealing with. Every time they selectively pick which question they want to get answered, and every time, anybody up at that level in front of a fresh conference, they just went like this, talked all around, gave no specifics at all. Never did we get specifics. I've gone back. I watched every Senate COVID hearing on, most of it's on tape because I'm out. I have never heard so much circuitous talk where there could be an hour and a half of Department of Health people talking, and in that hour and a half, you get nothing specific. And then some of the senators ask the right questions, some of them don't, and they say, well, could you get me that? Oh, well, I think we'll find it, or I don't know where that is, or yeah, we'll get it to you, and nothing. There's never been specifics. So who knows where those numbers came from? But did our leadership, did the governor ever say, give me the numbers, tell me the numbers? No. And let me bring this up. I've heard positive things about Janice, who is what, the deputy, right? That's her name, isn't it, Janice?
Yeah, the one they replaced Sarah with.
Yeah.
I forgot her name, honestly.
I've heard good things with her, but I'm already going to challenge her, and I'm going to call her out right now. Your very first day when you sat there, she said, "Oh, we have 100." She started to give these flowery numbers again. I was like, "Oh my God, we're right back to where we are." She starts throwing these numbers when I had just got off the phone talking to Jennifer, and she's sitting right within where all of this is going on, and I knew what the real numbers were, and I'm like, oh my God, here it is. This is no different. If this person's going to stand up there and not capitulate and say, okay, the time for throwing this out and making these ridiculous claims is over, I'm going to start looking at the people, telling them honestly. I was like, oh, this isn't going to happen. This isn't going to happen. As I said in the press conference yesterday, we need, beginning the next press conference, how many people that day were on the phone for a full day in an 8-hour day as a full-time person? Number one question. Don't tell me who's training. Don't tell me who's thinking about training. Don't tell me whose mother thinks they want to train. Who's on the phone? Who's working? Number one. Number two question is, how many cases do each one of those people have? Number three question is, how long after the person had a positive test did that person have the case assigned and make the first phone call to that person? Is it better be 12 hours? That's what it should be. That first call should be 12. The contact tracing should be done in 24, right? Then the next question is, right, what percent of those cases that you got did you close? Did you take care of, where you can say, I got 100% of the contacts traced? And then finally, after they've been contact traced, how many did you effectively manage to get the appropriate care, right? Because contact tracing is just not calling and saying, hey, Department of Health, how's it going? Is it windy at your place? See it? No, it's about answering their questions, creating follow-up, creating a process for getting these people tested. And then that's going to take me down my next rabbit hole. And I'm sorry, I got to go down this one, are they going to finally start coming up to this century to understand the number of people who are asymptomatic positives, and that anybody that came in contact needs to be tested immediately. They don't need to be just told, oh, go home, just go home. You just go home and sit down. No, they need tested. They need to know whether they have the disease or not. What happens about the conjugate living facilities? How many people are in that household? Another massive failure by our state that has led to loss of life and has led to so much suffering is, how many times have we been promised that there are these quarantine hotels? Okay, yeah, there might be quarantine hotels. It's like something that the Eagles sing songs about. They're figments in some people's imagination, because they're not out there being used. Because anytime we try to get somebody in a quarantine hotel, it's like this mythical beast that doesn't exist. And I told you, which is the truth, I have people that are sleeping in their cars because they don't want to give it to their family. They try to get them into hotels. Oh, I don't know. And then, it's just, then look at the disasters that we have in our homeless community, which is preventable. Look at the disasters in our prisons. Look at the disasters we're sending people in and out. And, it's just failure.
know,
Every one of those.
Charlie has a lot to say about the prisons. He has a lot of information from the prison. We'll get to that. But one last question for you, Doc, as far as the contact tracing, the priority of 65 years and older. I know you heard that during when they did the unannounced visit. Is that what did the whistleblower confirm that in fact they were basically what I got out of it was they were only calling people that were 65 years of age and over.
Yeah, that came right from Jennifer. And when she was the one that was investigated, I think it was Donna Mercado Kim asked her that because she was like, well, how many people do you have? And she goes, I can't even call them. I can only maybe try to get the people 65 and older. That's all we can get to. And that's just reprehensible. That is just the rationing
it's
of
criminal,
health.
Doc. It's criminal.
It is.
That's what it is. It's criminal.
It's criminal. And I hope that's what Tulsi gets to understand, that there are people that have caused people in our state to die while they're sitting on monies that were not being spent, and to specifically help the people of Hawaii. And what are they doing? Oh, we're training. Oh, yeah, we got people. We'll call them when they need them. We need them. Don't worry. We have this robust program. I don't want to go down there. You guys are going to get me all fired up again. So,
well, you even haven't seen Charlie yet. Wait, I worry about Charlie because we're getting to a point where he's bottled up. Go ahead, Charlie.
I always, in law enforcement, whenever you look at something, right, you always tell yourself, what is the motive? There's got to be a motive. I still, to now, I can't understand Sarah Park's motive to continually throw numbers out there. Even after the special committee went down there, I was told about the contact tracers. I don't know if she felt the numbers she would give would overcome the numbers that is actually there. So it made me wonder, who's allowing this to happen? Well, there's got to be Bruce. He's allowing this to happen. I would have put a gag on her right then and there. Said, stop already. The cat's out of the bag. We got to regroup. Don't keep throwing numbers out, right? That's number one for me. Number two, while they're going through all this, the sad thing is there's this acceleration process. The cases are accelerating. It's getting worse and worse and worse. So you're sort of like back at square one again, right? Because when Lieutenant Governor was on, I said, and what do we do about all these cases that never got touched? I mean, it's sort of like we're waiting for the dragon to show its head because we don't know where it's at. And what was important is when you brought that Dr. Wolf on with you, he kind of explained contact tracing. And if it's done properly, it'll go right back to the point, the origin, right? So that line has been cured. You found everything in that line. The way I look at it now, and correct me if I'm wrong, Doc, with the amount of investigation that's been done properly, I'm not saying, getting it all, but properly, we can't tell if a case popped up, if it's brand new, or if it's from a line that started when it was travel related. We don't know that. And that's what makes it scary, because now it's embedded in our communities and we just have to wait for the thing to show its ugly head and then attack it from that point. But by then it's too late. Too many people are getting infected. Am I correct on that?
Charlie, you are exactly correct. The failure to contact trace. Remember 6 weeks ago when these clusters were coming up, we were on the show and we're talking about a family in Kalihi, and then it was another person over there. And, and I even said it back then. That's not good, because what's happening back then that let this go on is after a while they found out it came from a family in Kalihi, but then they told them all go live in the same overcrowded household, and they didn't test them. And then they started getting another positive, and those people were going out and they were seeing other people and giving them to be positive. And then, as we know, there wasn't enough contact tracing. So that's exactly right. That is why we have the outbreak we have. We had the opportunity to contain when these clusters come. Mm-hmm. And we did not contact trace them to put the lid on them, to isolate them and quarantine them. As DeWolf Miller said, and as we have all the people in the front lines and anybody who's studied this for the last 6 months has said, the successful, and that's what also pisses me off is the roadmap is there. We know how to do this. We don't have to recreate the wheel. That's what I have been doing from day one, is following the model first South Korea, Taiwan, Singapore, and Germany. I keep saying those, and you just keep on it. And Department of Health just like ignored everything that worked. They almost made up things. They took bits and pieces of what CDC said, which clearly CDC has so much culpability since it's been under the thumb of a kind of a blind administration to even acknowledge this is happening. And we just kind of just picked and choose what we wanted to take out of it, ignored the best practice of what was working. Ridiculous, you know? And so contact tracing has been crucial to make this happen. And testing. It's testing, contact tracing, quarantine, isolation, and repeat, and repeat, and repeat. And that's all there is to it. So, motives?
We don't
Everybody,
know.
yeah,
We
yeah.
don't know.
From
Well,
day
you know,
one. Oh, go ahead, Charlie.
So now we got the prisons.
Well, before we get to the prisons, and
Wait, they're going to probably be saving. DOH is probably going to save a place for me in there at the end of this.
I
Man.
think
So,
the three of us will be in the same
yeah,
shells,
yeah.
in the same shells, sharing with another 170 people. That's the problem. But you know, right now, Doc, right now, when I watched that the unannounced visit, and I heard Jennifer, when I heard the numbers, 192 cases, 132 cases, these guys, as you said, Charlie and I know exactly how that is, you know, as an investigator.
588 cases.
Huh?
Well, I remember I told you the thing I read to Lieutenant Governor Green. I went on and I read the paragraph. One person had 588.
Yeah. No, I mean, so we know one thing, right? It was definitely not done effectively. We know about the 65-year-old threshold, blah, blah, blah. This is the question I have, and this is what worries me. A lot of people fell through the cracks. A lot of contacts were not contacted. A lot of people that were level 1 contacts were never contacted, never traced, never tested. And we know we're on lag of testing. How far behind are we? And how dangerous is that for the general public, not knowing how many people are out there? We don't know what we don't know. I guess the bottom line question is, how much more of a surge do you expect in the next, until we catch up?
It's going to continue. If you look, let me throw some national numbers, and generally, you guys know I've been on all the national media, and I'm working across the country now, across the world on this. In the United States, our best estimates are 6 to 10 times the number that you actually have are actually infected. Okay, so if you take, now, why is there a variable on that, and why will I have to caveat it? A lot of it has to go with the community spread and the prevalence of the disease in your community. So if you would have asked me, which I think I did on your show 3 months ago, when our curve was flat and we were getting 0, 1, 0, I was like, yeah, man, there's not much going on out there. There's not a whole bunch of disease. No, we're not like the other places, like New York was surging, that has so much disease and things like that. Now it's exactly the opposite. We have now probably taken over as we're number 1 on Oahu, and we are number 1 on a very serious number, which is the reproductive rate, the transmission rate, the contagious nature. There's technical terms, but the actual virus that's spreading on Oahu is essentially the most contagious spreading virus of anywhere in the United States based on data. Probably the same virus, but we're transmitting it more. Then the other point I keep talking about is the growth in our percent positivity, meaning that the number of tests that are being done, and then how many percent of those come back positive. Now, the reason I can tell you that number is underestimated is, I can tell you because of what we're doing. Just today, I had 3 new hospital nursing homes. I got called this morning. I've already tested them all. My office, my staff are just incredible. I mean, literally, I got calls at 9 and I was testing at noon. I had strike teams there. I got called at 1 and I had people at 3. And I just got, while we were on, I just got text, my staff was just leaving, 180, 200 people in one, 180 in the other. And these are high risk individuals, but you're doing broad scale testing. And so those numbers will skew it, because when you have a conjugate living facility, you do test the whole facility. But yet you know that there'll be expectations that certain areas are going to be at higher risk. So the numbers are even higher because we're doing such broad scale testing with broad scale outbreaks. That's really devastating for us right now. So our numbers are going up, the number of people on Oahu that have it. And the other reason, that the other thing I want to shout out, I wish the doctors on Oahu would listen. They have been so brainwashed by our Department of Health, and they're just absolute wrong recommendations. I still have almost every major facility of doctors that their patients call them to get tested, and they say, well, what are your symptoms? Well, my brother lives in the house, was positive. Would you have any cough? No. Well, we can't test you. That's across the island. Hello, please. And that should be, it's another massive failure by the Department of Health, is there's been so poor communication to the medical community that there's such broad misunderstanding of what this disease is about, how to test it, how to track it down, what's the responsibility. I get, another one drives me crazy is I get people that, like, for example, one of the places I was at today had an employee that calls off sick for 2 of the 3 days, and her doctor gives her, even though she had a runny nose and congestion, gives her a work note for being off and to return, but didn't consider doing a COVID test. The person comes back, and of course, they're COVID positive. I mean, that is reprehensible that the doctor didn't even think about it. And I've so many doctors that I'm hearing about, well, I think, probably was the flu, or probably, we don't have to. No, hello, everybody, every person listening to this, every doctor, please, I'm not blaming the docs because they have not been educated by our Department of Health. If you have cold, congestion, runny nose, fever, headache, fatigue, and you don't feel well, and muscle aches, don't write it off as something else. In this day and age, get tested, get the COVID testing, and then take a sigh of relief to know, because those are the people then who are spreading it. And I don't blame them. They don't know, because no one's educated them that, oh my God, I mean, that's how subtle the symptoms are. And that's how I'm spreading it, and how it's going into my workplace. And look at the workplaces. Poor HMSA, bunches of people on the floor. I mean, how many employers are just having entire people going into a floor? And those employees are probably not sitting there hiding and coughing their lungs out going to work. They're probably just low grade nothing, and didn't even they haven't been educated to know that that's the symptom that you should look for, and they should go get testing. And that takes us to another issue. There's just nowhere to go get tested. Our facility has people coming from every corner of Oahu, because I just keep boosting up my staff to provide access to testing. So,
Doc, real quick, is there an issue with testing? Are we still lagging with results? We keep hearing the capacity. We don't want to waste all our resources. I mean, I've heard even someone posting right now. There's a couple of posts about people that the doctors did not test them because they didn't have symptoms, or they had mild symptoms. But is there a crisis with our test supplies?
Beyond.
Is there still a lag on testing?
Beyond crises. Beyond crises. It is another one of the things that is gross negligence coming out of the Department of Health. They're sitting on funding that was supposed to be for contact tracing and testing, and we're sitting here. I mean, clinical labs has been amazing. They have been so outstanding in everything. We work closely with them, their staff, their doctors, their heads of their labs. Their communication has been outstanding. DLS was at the same time, but then they just kind of half got shut down with their loss of reagents coming. And then also remember, DLS supports Queens. So a lot of their focus had to turn to the surge to do Queens. So we're really relying mostly on clinical laboratories to do the testing. And for example, I just got word from them early today, late yesterday, that the reagents, people have to understand that's the liquids that they have to pour into the machines to be able to process those tests are the big thing that are in short supply across the country and the world. Their shipment got delayed a day or two. So the tests that we're running today probably won't get hit till Monday, even though we have some higher ones that we need to get into. Not their fault. And right now, probably with some of these broader testings that we're doing, about 75% now are being shipped to the mainland and are being 4 days turnaround, sometimes 5 days. I'm getting reports, not of ours, but of the other organizations using DLS, that they're 10 days. I just had a 14-day. So it is disaster. When you have a high surge like we have, as I said yesterday, and I'll say it again, and I've said it from the beginning, and I'll talk about, I could turn you over, anybody just do your research, look at South Korea, look at all the countries, look at the test per capita, look at the turnaround. One day should be next day. And now, so look at why it's a disaster. We have the highest contagious rate, the highest spread, and now we have the longest turnaround. You don't have to be a doctor to understand we are in crises. Has the Department of Health done one thing to address that? I've been on your show from the day I'm the one that announced the DLS crises. And I started to announce then to say, get more testing, get them more machines, get them more reagents. We need to do whatever it takes. I was going to do a freaking GoFundMe for them because that's how crucial it is. Here we are, 6 weeks later in a surge. Anybody at those press conferences saying, oh yeah, we realize testing, we need to get more testing? No, they're not even talking about it. Not even talking about it. So I will announce first on the Mel and Charlie show, because I'm working as a national consultant. I'm involved with massive discussions with organizations throughout. I just got off a conversation yesterday. I've been working, and I'm going to be reaching out to, I'll go to both DLS. I've already told clinical, but I'll go to DLS. I have developed a new relationship with a lab in suburban LA that I'm having them send me agreements to do 10 to 15,000 a day. And that would be a lifesaver for us. They'll run them within 24 hours of arrival. So if we can get them on a flight over, we could start having 36-hour turnaround, and they'll contractually agree to 10,000 a day. And how am I the guy that has to do that? Why am I out there? And so.
Well,
Sorry.
Thanks for what you're doing. And with all these, we got a lot of flights that could put that nice little refrigerated cooler with samples going to LA. We definitely, I'm sure the airlines would be able to throw that on, but we definitely need some help.
Well, they do have questions about those seats that's not supposed to be taken. Those block seats. So you have create social distancing. Maybe what we can do with your test kits and put them in a cooler, put them on those seats, then everybody will stay away from each other. Just put on top,
Jails, OCCC, the jail system, out of control, totally out of control. Charlie has got great resources and sources, I should say, in that community. So Charlie, why don't we touch on that a little bit?
Yeah, that's really been a sort, side pain for a lot of us, because you remember back when we took the prisoners out, when there was not even one case, and they say, well, we put them back in, and then comes to find out, and then I'll go over the timeline, but comes to find out there was no protocol in place. no protocol in place. In fact, today I put up a post from one of the
I saw
facilities
that.
on Maui. They said, when we talk about the 14-day, they're accelerated to 5-day, and I don't know why. Before taking them out and putting them out in general pop, so that's something that it's crazy. It's crazy. I don't know why they would do something like that. But the timeline that I was given by several sources started at the beginning of August, August 3rd, a Monday. Prisoners brought into the facility and go through the routine of getting tested. Well, the test results, and then he gets taken to a quarantine population. So how that runs, my thing is, I was told there were several individuals now. It's not everyone's isolated from each other. On Wednesday, a little birdie from the medical unit starts getting alarmed because bingo, it came out positive. The test came out positive. But the prison system didn't do anything about moving that person out into isolation, left them there. So now comes Friday the 7th, and then they decide to do something when I said, hey, something's got to be done. With what information I got, I turned it over to who needed to know. I did turn it over to um, uh, the LG and says, you got to move on this thing because it's going to get out of hand. Well, at the same time, they just did that news thing on the guard that's really sick. He was one of them that came in contact, but nobody from the Department of Health told him to go get tested, or nobody from the Department of Health said anything about getting tested. So he had the presence of mind to go get tested, and bingo, he was positive on the 8th. That's a Saturday. So still yet, nothing is being done until Monday comes around. That's when massive shifts, moving people around. But one of the things from one of the sources said, the person who was initially infected, to move that person around, not into isolation, took that person and put them into general population.
Oh, God Almighty!
So I had to think to myself, nah, it can't be. Now I know why the numbers are climbing the way they are. That's what it appears. Because if he was in isolation, he wouldn't get that close to start infecting a lot of people. Now, not the rate it's being infected right now. And so here's another thing I just got today from two sources. A source says, you won't believe this, but we're going to get tested. I said, okay. Well, we get tested, we go back to work. If you came in frontline contact, you get tested, go home, correct? They get tested, they're told to go back to work. A couple of days later, when the results come back, and if it comes back positive, then they tell them, you need to go home because you're positive. In the meantime, that person's floating around in there, in the prison. That's what didn't make sense. When I heard that, I said, what? You guys get tested and you guys told to go back to work? He goes, yeah. And we don't leave, we're not sent home until we get a test result back. I said, that is nuts. So when I saw that news conference with the head of Department of Public Safety, they have all these protocols in place. I looked at it and I said, man, they must have a special school for all these department heads. And they teach them how to bullshit. That's what it sounds like. I went, oh boy, here's another. You got Sarah Park, you got Bruce Anderson. Now you get this head of the DPS saying things, and yet he shows up at the Supreme Court, right? They wanted information about all the prisoners, how they're gonna do another early release program. He's speaking on the news conference. They got everything in place. He knows what's happening, but yet he can't speak intelligently in front of the Supreme Court justices. It just didn't make sense. And I said, this thing is gonna bite somebody in the okole. It's gonna come back really rough. So that's where it's at now. There, now,
Well, geez, I'm just jumping out of my chair because obviously, I kind of was in a little bit involved in this, and I made some outreach because I'm working with the prison guards and I work with their unions, and there was some communication, and I offered to have a strike team out there the day they had positives. I would have tested the entire facility. I would have tested every guard, and I would have tested every prisoner same day. My understanding is they still haven't gotten through the whole population yet.
They haven't.
No, they
They
haven't.
haven't.
Because when they tested, the memo that went out, which is kind of crazy, and this is why it's bad. One, we haven't gotten to the entire population. Two, the initial test was only held for administrative personnel only, not the guards.
God almighty.
So the guards was going, hey, but here's the problem. When nobody is tracking how many guards are being sent home because they may be positive, because they came in contact with someone positive. My understanding now from the source is several positions had to be shut down because there's not enough staffing. So what they're doing is they're taking prisoners and cramming them like sardines into places where they can be watched. Now you got a volatile situation brewing now.
Unbelievable. Okay, let's go back to this. First of all, where does the problem lie? This is a failure of our Department of Health again. Go back, watch our tapes of what I've been saying back. Not that I'm, of a crystal ball. It's because this is going on across the country. The outbreaks in the prisons, the people dying in the prisons, the people dying in the homeless facilities, the people dying in the group living facilities. The roadmap is there. What we need to do is there. And what should have happened? There should have been massive oversight and education from the Department of Health on how to do this. There should have been testing that should have been going on. There should have been someone saying, wait, that protocol doesn't make sense. What do you mean? You're talking about person in 5 days or what, how does this work? And then you have an outbreak, right? Well, we have a high prevalence, we have a high infectivity. Should have been done just like we're doing across the state. You go immediately, you shut it down, you quarantine, you isolate, you test everyone, you test the guards, you test the prisoners, you create granted they can't take it out. I could have been down there in 2 hours and could have designed a quarantine facility for them. And then we could have gone through the prison population and decided what's called an orange zone or an isolation zone. And you would have separated everybody out and you would have tested the guards. I mean, this process of how to do this, I'm doing it every single day, multiple times a day. And the groups and organizations I'm working with in the United States are doing it across the United States and across the world. I have the best experts I could turn to get any kind of reference. And I'm doing this all for free. All my time, I'm going in and volunteering for free. And now they're just piecemeal and doing a little bit of testing there and trying to cover it. You have 200 and some inmates that are positive. When is somebody going to be held criminally negligent for just this? And now we just get little warbles up at the Department of Health. No, we got it. We'll do contact tracing. What about the rest of the state that's just out of control? There's no guidance. There's no leadership. I mean, the calls I get from workplaces for return to work, no one knows anything. It's just so varied, the information, because the public is just blinded with no leadership and information. So,
well, Charlie and I are not experts. By far are we experts from in the medical field, COVID field, but we've had a ton of them on. We've had a lot of experts on this show for the last 5 months. And every one of them, every single one of them is in agreement about testing and contact tracing. From day one, Doc, you've been on this track since day one. All of the people we've had on this show agrees. All of the people you see on TV, on CNN, on any of these channels, any expert. We have people from Korea that tells us testing and contact tracing. The only place you can hear that testing and contact tracing is not important or is not the answer is here at our Department of Health. It sounds really exaggerated, but it's not. That is the fact of life. I mean, you can go try find an expert that says testing and contact tracing isn't important. You won't find them except here in our Department of Health. I don't get it.
Wait.
And they still have. Oh, I'm sorry.
There's one more.
Governor's office. Governor's office.
No, Trump appointed CDC people. When I was reading New York Times today, how someone came out and some deputy at the Department of Health that got put right in there and say, no, we need to test less. So
Yeah,
it was front page of the New York Times. Yeah.
We have a Democrat state. We have a Democrat governor. We have a Democrat legislature. Everybody's a Democrat. And I don't even look at this as a political issue, whether it's a Democrat. I don't care what Trump or whoever says. We have a Department of Health that should be independent of anybody up in Washington, D.C. or anybody in the White House or whatever. I mean, these guys are supposed to be trained experts. I mean, they should be trained experts. I don't understand. Even at the day that she at the press conference, the last press conference, even her successor, whoever that Wahini was, I forgot her name, it's the same thing. We know the mask, we know the social distancing, we know the hand washing is all vital. But that is, if we don't have a good contact tracing program in place, people are going to get sick. And it doesn't seem like that is the direction that this Department of Health is taking.
So guys, okay, I'm going to throw this back to you now. We are where we are today. I wake up. I mean, I'm waking up. I'll be up at 3 a.m. today on calls back with all over the planet, and my days are long and nights are getting shorter. I try to wake up and I try to put what's ever in my rearview mirror. It's back there. We're past it. I'm not going to dwell on the past. That's just how I do. It makes me angry, and I've been really angry. And you guys have seen me. I'm pretty calm, but I mean, my calmness is turned into just like when people are dying and we're being lied to. I don't take lying. I was raised differently. You're honest, and then to have officials where people's lives are on the line and they're cavalier about it. No, they're going to die. Something's got to happen. Okay, so we're here today. Where do we go? What do we do? What do we do as a people? What do we do? I know what I do, right? I know what I'm going to do. I'm going to be doing the same thing and even more. As a matter of fact, what I'm doing right now is I'm hiring more staff, creating more contact teams, more strike teams, because I know the volume is just going up. I'm running my staff 7 days a week, and I need to keep adding more teams on. We got our Big Island teams. I talked to Mayor Victorino and offered him any help he needed because they now have the same disaster Maui Memorial. And so my plan is not changing. I'm going to wake up and I'm going to keep testing. I'm going to keep offering services. I want to give a shout out to all the nurses that are on watching it. Dan Ross, the head of the nurses union, and I have linked up, and he is fed up, as I am, to not know that the hospitals or care facilities, they're not offering testing to their staff. They refuse to test their staff. That's abhorrent. So the nurses, in a high prevalence time right now, when you're working in an emergency room, you're working in ICU, I don't care where you're working, weekly preventative testing. You're putting your life on the line. Your family relies on you. We need to start testing these individuals. And so I'm creating a program working with the nurses union to just start getting these people tested by best practice, because they're going to turn positive and not even know it. So that's one thing I'm doing forward, but I'm going to keep working. I'm working on more vigorous contact tracing within our positives. When we get positives, we're trying to bring their families in right away and not rely on contact tracing. And we're going to keep increasing the number of drive-throughs that we're doing. And so that's what I'm going to do. So now I want to challenge you guys and say, what can the regular person who is sitting there watching this aghast, what can we do? What is our charge?
I got one question that I really wanted to ask, and it's pertaining to the jails, and it's a medical question. I work with a spouse of an old CCC guard. Should I be worried?
No, that's how she's a first degree. If the guard was positive, she should be quarantined, she should be tested, and she should be followed through. Then you would consider it. But no, if the guard is just working and the guard's negative, not an issue. if the guard starts developing any symptoms while he's developing symptoms, she needs to immediately get tested too, and she needs to go into quarantine until all this passes. And there's no communication, and I mean, just the hideousness of the totally wrong recommendations coming out of the Department of Health. I mean, I just had with the city and county, and they had some doctors that work down there for the city and county who were talking, I guess, to Sarah, trying to follow her advice. And they were saying, oh, all those people you're testing, all 500, 600,000, they all have to go in home quarantine. I was like, no, they don't go in home quarantine. The home quarantine are the people who are the first degree contacts. Anybody who has symptoms, those people are going. These other people are being tested in a preventative basis due to the cluster outbreak. And if they develop symptoms, they go in quarantine. If they were close, if they've got a family member. And here, even in our medical professionals who are supposed to be like, paid to do this or be advising, they have no clue. And it's so varied. And then the Department of Health says that if you're tested, you have to go home for 14 days. It's not a blanket. It depends. Every situation is different. There's guidelines on how to do it and what the best practice is. It's like, anyways, okay, let me be quiet and let you guys talk.
No.
Well, here's I just got a text. This is from a guard. So it's I'm gonna read it really fast. This is from a guard that just sent this to me now. His first text is, hello everyone, just wanted to inform everyone that I had tested positive for COVID-19 and will be self-quarantined till the 19th. According to the state healthcare department, as long as I'm not running a fever or high temperatures, I will be cleared to return to work and resume normal life. Hoping the best, you all be safe, take care of precautionary measures, because it's no fun having the virus. He sends a second text, and the second one reads as follows. Now he talks about his dad. I would like to ask for prayers for my dad, who is in Queens Hospital because of COVID. He supposedly may be going into ICU today. My dad has been in the hospital since Monday, and it appears he's not getting better. Please pray for him, and I would appreciate all your prayers. This is a father and son.
Did the father get it from the son because the son got it from his workplace?
It sounds that way, just by what I'm reading. That's what it sounds like.
Isn't that, I mean, how much of this are we going to put up with?
We shouldn't talk anymore.
I guess, I was going to save this question for the end, but I did want to answer your challenge. What do we do? What do the people do? We profess this every night. We say this every night. While we still bring on people like yourself, we still tell people to rely on individual responsibility. We got to be responsible. The congregations at the beach got to stop. We're seeing it all. We're still seeing it. Regardless of what the government does, we're still seeing it. People got to be responsible. They got to stop being selfish. They got to stop hanging out and having the garage parties, having the painas after work. That's got to stop. We got to stop all of that nonsense. This show was able to raise enough money to purchase 800 or 700 shields for our keiki. So we trying everything we can, Doc. We're not doctors. We have no say other than the relationships we've built with people like you and people in the legislature and in the lieutenant governor's office anyway. We are trying our best to get the message out. We brought on a survivor last night. I don't know if you saw that. Sarah Boles was on. She told her story right there from Honolulu. Almost died from this virus. We're trying everything we can to get the message out how important it is to wear a mask and wash your hands and social distance and stay away from possibly positive people. But we also expect the government to do their part. We expect the government to do their part of getting out to these potential carriers and letting them know early on. Let's isolate the virus, especially in cases where someone has already been tested positive. So we expect that, but nonetheless, we all got to take individual responsibility because this virus is here, and it seems like it's in a very aggressive stage as we move forward. So that's the best I can answer that, Doc. And I'm trying to have another.
No, hey, wait, no, I'm not letting you get away with that. That was a nice politically correct statement. We are being failed and we are being lied to by our elected officials, and people are dying. Now, I'm not talking about inciting, things in the street. Of course not. How do we get our word out? This is not acceptable. Bruce Anderson needs to be replaced. Most people, they call him doctor. He's a PhD. He's a guy that trained to do, like, when something's wrong in the soil. He's not a medical doctor. This is a medical pandemic. He's clearly way out of his league in dealing with this. Sarah has already shown that she's behind a computer and she's there. And now we're just being told people are being promoted. We have no leadership in our Department of Health that has any background or any education or any understanding on how to deal with this. And everything they have done has failed and is causing the death of our population.
You know what? Doc, I'm still trying to wrap my head around this thing with the DOH, because just the mere fact what they showed on the news, that surprise visit. I mean, you've seen it, and you've talked to your whistleblower. And just the desk she sat at, you got stacks of papers going as high as, it forms its own cubicle, just with the stacks of paper. That in and of itself is just, to me, unacceptable already, because I don't know how she's able to find anything. It's just so cluttered, let alone having to do the business. A lot of people said, and we brought this up the other night as well, Mel and I. The convention center is open. You get plenty of wide open space. There's no big events going on right now. Why don't you set up the damn places like what they did with the unemployment? Set it up, put the contact tracers in there, and start getting this done. Because the longer we brew over this, and I'm guilty of it too, but you see, the reason why I got to taper my, and knows this, I laugh a lot, because I tell people, you should love me when I laugh, because you just don't want to piss me off. And the thing is, putting people in there, even if it's for the minuscule portion of a job, getting names, you know what I mean? You don't have to have a degree, just, making contact. How can I get a hold of you? I'm going to get somebody to you right away. Get names. At least you're starting. But to leave a bunch of names sitting idle and forgotten after a period of time, I think that's the frustrating part.
Well, you guys are probably aware that Josh is already trying to do that. I've been involved in threads where there's an outreach to the medical community to try to get 500 volunteers by the end of next week. Will it happen? Yeah, I mean, Josh could do it. I could do it. I said it in the Tulsi press conference. They said, could you do it? I said, I helped lead the charge to get the people for Samoa. And I was reaching out. I said, I know the heart of our medical community. People would do this and volunteer. And so, yeah, it could definitely happen. But will we get cooperation from the Department of Health? Yeah, good luck. And then, okay, but here's my problem, guys. They're still getting leadership from the same leaders. They're still being told to do the same wrong things. That's my point. So once you make contact, that's only the first step, right? Because the next step is, all right, you need to aggressively do this. Well, the leadership up top there coming down, which is the same leadership, because we're not replacing them, is saying, just go home, just go hang out. And, do you have any cough or cold? Okay, then you're fine. Instead of what the world knows we should do, anybody who is close, anybody even in the first degree, get tested today. Here's your testing facility. Go ahead. We'll make arrangements. So just now throwing this little blanket, oh yeah, we got more contact tracers, and then getting the lip service, if they're not getting the leadership of what the best practice is of what to do, so what? You make contact, you tell them to go home. That's great. That is important. But then you still let all the other people get infected, or you're giving them misinformation. Then the second issue is, as DeWolf said, and as we've been saying, you have to get tested. Well, what did we just say? They haven't done diddly to get us any testing. Our testing is a disaster. So now these people can first try to find a place to get testing, because most of the places are still listening to the backward, wrong Department of Health advice. Oh, they don't have a cough, don't test them. And then the insurance companies are saying, well, if the Department of Health says, then we're not going to pay for it. And then you can't get tests back now for 4 or 5 days. So now we're back in this vicious circle. As Dr. Miller said, you get the positive result 5, 6, 7 days from now. That's not how this is done. You need it in 24 hours. And then let me go into the next thing, failure. Is this prison failure going to lead to anything? No, we're already releasing people back. We're sending them back and forth. And then the disaster down at the IHS men's shelter, I'm getting direct feedback on it. It has been mismanaged from day one. It has been an accident waiting to happen. The shelters have been mismanaged. Who's overseeing the shelters? They have a Department of Health social worker that is responsible for COVID in shelters. Give me a break. How on earth could we now have shelters that are vulnerable, which we know conjugate living facilities are vulnerable, but there's no advice. Nursing homes. I'm going to all these nursing homes. They're not getting any help from the advice. They'll get occasional inspection. They get some papers that are sent to them. They're flying by themselves. They have no idea. What's the next massive problem? I was at 3 nursing homes today, all with positives. All of them have positive people. All right. I had to go in and try to help them design makeshift quarantine facilities, because guess what? Another massive failure that will lead to loss of life is, unlike every other state, we do not have a quarantine facility for our positive senior citizens and nursing home residents. They have to try. So they have to try to figure out the skill set for nurses and the types of people caring in a nursing home. They're not ICU people that are used to putting PPE and masks and changing and all that. That's a very special skill set for very special trained people. I totally feel for these people at the nursing homes and what they're going through. So now this is live today, and I've done it with 10 other nursing homes. And these people have no place to turn to, when we should immediately have been prepared to transfer these people to another facility. Failure.
Doc, it's scary. When you look at our beds, our ICU units, ventilators, you look at the surging, you look at the amount of people. I got a talking with a nurse from Queens, sharing with me the crisis that's happening there. We don't have medical personnel. We keep hearing about, we can surge up, we can put more beds, we can build field hospitals. Where the people gonna come from? Where are the doctors and the nurses gonna come from? So we can build the structures. You still got to get those trained, experienced medical personnel to treat the patients. And then Calais, for your information, Calais post, come on guys, Mel, Uncle Charlie, come on, you two lowering your heads was a giveaway of guilt. Just for your information, it must be a new viewer. Our phones are down below so we can track our comments from our viewers. We try to track and get questions. So if looking down is a sign of guilt, I am guilty. Sorry, Calais. Anyway, my concern is that we, just getting space for these people, getting people in hospital beds and ICU units and ventilators that can save their lives. So it's the legislature can impeach Ige. That's the Hawaii Constitution. The legislature is the only body that could impeach Ige. The legislature can bark all they want to Ige, Anderson can only be removed if Governor Ige removes him. He's an appointee. He's an appointee from the governor. Now, I would have fired him a long time ago. I would have fired him months ago, and you know this because we never hid our frustration with Bruce and Sarah, but the governor is the only one that can do that. I told Charlie this morning. I said, you know, while I don't think this will happen, this is what I would like to see happen. I would love to see Governor Ige take the podium, and take responsibility, take accountability, and say, hey, you know what? I'm here to apologize, and really, we're in a crisis because I surrounded myself with people that I trusted that really didn't give me good advice. And
Exactly.
now is the time to come together and put the right people in place so we can get through this crisis as quick as possible. But he needs to take ownership. He needs to take accountability. He needs to take responsibility. The lying, automatic termination. You lied to the public. You lied to the legislature. You lied to a Senate COVID committee. And if they lied to him, then if they didn't lie to him and he was part of the conspiracy, and that'll be found out when Congress gets done with this state. And we'll have Tulsi on the show next week, by the way.
Good.
To talk about congressional action. But my point is this: we can urge our legislature to impeach the governor. That's going to take a long time. What we got to do is urge the governor to get rid of the Department of Health and put qualified. And I would love to see, honestly, I'd love to see you in there. I'd love to see you and Josh take over the medical crisis of this COVID pandemic. That's what I would love to see. That'd be the dream team for me. I'm just being real, man.
No politics for me. No politics for me because
not politics, man. You be hired. We need freaking people that know their stuff and are non-political. That's right. I guess what I'm trying to say.
Well, let me thank you, but you know I've already that's not in my future.
The governor would never put you there anyway. So
no, it ain't happening. That's for sure. Like I said, I have a better chance of sharing a cell with you guys than doing that for what So, does any of you guys snore, by the way? But anyways, here's what should happen in my mind is if the governor would stand up and do exactly what you said and honestly look everybody in the eye and just say exactly what you said. I trusted these people. I'm sorry. Things are going to change. And show them the door. There's such an easy answer to this. What he should have done at the beginning, put Josh in charge. Whoever gets selected to be in the Department of Health reports up to the Lieutenant Governor. Let Josh run this whole effort right now. He would, if he's a good leader, he is a doctor, he should have been in charge of from the beginning, but is also part of his leadership style is if he would find the right people to put in the right positions and guide for the right reason. That's a simple answer. That's all that needs to be done. And then whoever gets into that position has to have, and then there has to be an accountability of a group of leaders where there's collaboration. You have this Bruce and Sarah, no one outside. They put Josh over there with Hara and don't communicate with him. And where are we? Where's the rest of the public and the community and the medical community? The medical community, we've been in the blind. These little foofy things that are sent out are worthless. There's no communication. I mean, you need to start communicating to the public and to the medical community. I mean, we got to start from scratch. That's my point of what I just said. Every touching point of this has to be redone, has to be fixed. And so it's not like you can keep letting the same leadership in and just have someone else come up to the podium and talk the same story. These are massive structural overhauls that need to occur. And I don't want to be too bad of the bearer of bad news, but guys, this isn't going away. This is not just going to fade away. We're going to have COVID is going to be, you're reading what's happening in the national media. This is going to be the worst fall and winter in healthcare in the modern history of the United States of America. Okay? This is going to get worse. And we're going to be sitting here playing around with this with the same bozos that don't know what they're doing, when we need to be now preparing and preparing and preparing for what's going to happen. And I don't even want to talk about, COVID 2021 or COVID mutation, because most of the health experts, we all know that this disease is not going to go down with a whimper. And we all know that a vaccine is, as Dr. Kim told you, who's a great, great person, love to hear, and I have outside communication with him. He is such a great expert. Vaccine, it's going to have to probably be redone. We're going to be vaccinating for this on and on. I mean, our lives are changed. We need to get ahead of this. We need to take control of it. And that's not happening in our state. It's taken control of us, and it's out of control.
Well, you said something very interesting, and Mel, that is, we got to keep the politics out.
Yep.
We got to do that, because whenever politics takes priority, everyone will jockey for a position. So by jockeying for that position, what happens is all the important stuff that needs to be done falls at the wayside. It won't get done. I would highly encourage, who's ever watching tonight, go on the Hawaii.gov website. There's a place where you can email the governor. Send him a compassionate letter. Just tell him how you feel. Flood his email box. Just flood him. Just
Right.
let him know. Because then he gonna know the people of Hawaii is serious. Right now, I don't think, I gotta believe he's a rational person to a certain extent. But I think what you need to level the playing field by sending all those emails to him, so someone or his staff actually reads them and say, hey, you know what, Governor, there's some pretty serious emails. I think we got to answer this. How you answer it, we just got to wait and see. But right now, we can talk to him blue in the face, but we got to send something to him so he knows that we mean business. And you're right. You're right, Doc. It's not about we want to incite a riot. We need to get someone in there that can sit in the pilot seat and fly this damn plane so we can go back to life, not as how it was before, but pretty damn close. Because right now, we just got drones flying, and we don't know who the hell is guiding it. We need someone guiding this plane in the right direction. And if it means sending all these emails, we got to go for it. We have to.
I agree. And, that's what I'm saying is moving forward. I believe we have the United States of America. We're the greatest democracy in the world. We have the greatest democratic process, and we need to utilize it here. And you need also, people listening, ping your senators. Because I think I have a lot of backdoor with a lot of the senators. They are not happy. They are not happy. There are a lot of people who are not happy. And I think they need to hear from you. You need to ping your senators, because your senators do have the power where, I think I'm hearing this conversation all the way around, that if there isn't some kind of quick move on quick changes through the Department of Health, more than just a little window dressing, that by mid-end the next week, there's going to be a loud bell sounding that the governor is next person that needs to be discussed whether he should be staying in his position. And I'm not, I've never had anything. I've met the governor numerous times. I don't have anything against him, but this isn't time to play around. He needs to understand that this is the life and death of the people of Hawaii are at stake right now. And there is a massive, massive mountain range as we're flying these planes ahead, and you don't need a rookie pilot or somebody who has no clue how to flying it, and then beyond that, this is like Lewis and Clark. After you found the Rockies, there's more and more and more, and then you find the Whitewater and the Rapids, and you go, oh my God. So, yeah. So we need.
I know the governor as well. I mean, my wife and I has had dinner with him and his wife at functions. I never had an issue with the governor. I always saw him to be, he's an engineer, he's an analytical guy. That's why I'm so surprised, Doc. That's why I'm so surprised that he's not able to to figure this out. I cannot believe that he's put all his faith and trust in a couple of people that seem clueless. When the media asked him last week at his press conference about the Trans-Pacific quarantine, he never brought it up in his statements. He never brought up the schools in his statements. But when he was asked about both of those things, his response was, we're having discussions about that, but we're not ready to make a decision. We want to wait a few more days to see the case count. Then I realized at that point something is wrong with him. Something is definitely wrong, because we are surging. We're having people die every day.
Yeah.
Every day somebody's dying, and we want to wait a couple of more days to see the numbers before we make a decision on whether or not we're going to extend the Trans-Pacific quarantine. Then I realized that's not the same David Ige I knew when my wife and I was sitting next to him and his wife having dinner. I realized at that point he's either under a hell of a lot of stress, or, as I stated from day one, Charlie, you my witness, pal,
Somebody pulling
that
his.
the priority in this crisis was the visitor industry and not the health and safety of the public. And if you don't believe me, go back on my YouTube channel, watch the very first YouTube that I did back in March, and that's what I predicted. And when that came out of his mouth, then I realized this is not the same David. And I kind of had a hunch a few months ago, but that it was clear then, because we're in the middle of a surge. It was very okay to shut down the state when we were running about 12, 13, 14 cases. But now we're up at hundreds, triple digits every single day with deaths. And we're not ready to make that commitment. Then I knew we're in trouble. We're in trouble. And I agree with Charlie. The best thing you can do right now, people, the best thing you can do right now is hit that share button. You hit that share button on your bottom of your screen, wherever the hell your share button is. Hit that right now. And I know, Doc, thank you for staying with us. It's already, we went half an hour beyond our time. I thank you for that.
Hey guys, I'll stay here till tomorrow if it can
Don't
change.
tell Charlie that. Charlie no
stay-
sleep. Charlie doesn't sleep. Don't tell Charlie that.
Charlie, did you tell Mel what time you and I are emailing each other?
Yeah, because we're you and I are both having conversation with our counterparts in South Africa or someplace, right?
Yeah, I have 3 a.m. with the one team we have in Africa, and then London, and then I'm on the East Coast, and I'm on positives. Hey, can I end with a positive thing? I want to end with
please.
You know, my COVID dreams are going to be bride tonight, because yesterday we were on with the commissioner of the SEC and the assistant commissioner, and the programs that we're going to be running and designed are green lighted, and it will be officially announced. And it's, of course, if the disease count goes up, but the SEC is going to be playing football. First kickoff is going to be whatever the Saturday is, end of June or September, like September 26th. And they've accepted the program I've designed. And actually, I get to fly down there at the end of this month, and we're going to start the program. So football, SEC football, will be a little reprieve for us to all be. And I get to go to whatever game I want. I get to go wherever stadium I want, and I'll have about 70 employees across the South. I'll be working for my group that will be doing and executing the testing plan that we designed. So.
Mel, did you hear Miscovich mention our name in any way with
No,
that?
exactly. What I didn't hear
Flying down
was,
yeah.
You realize, Dr. Miscovich, after your performance at the press conference yesterday, and even more so after tonight's Facebook Live, you're gonna need 2 bodyguards with you when you go to that game.
I don't know, man. No, I have this, and this is my dream. And I was telling Robert Kikawa this, because I'm down there at KITV, and I said, Robert, okay, I have this dream. This is like my fantasy, and it's going to come true, because I think you guys know I played football at Cornell, and I was a receiver, and I'm going to get taped. I want to catch a pass in every end zone of all 14 SEC schools, because I will have to go at least twice to every school to be overseeing the program. But I want to, and I never dropped the pass, and I still don't, and I could still run. I'm in very good shape, and so I'm going to get out there and I'm going to be catching a pass in the end zone. Now, who's going to throw it? I don't know. I don't care. I just want to be
I'll
out there.
throw it. Damn it! I missed one pass. I dropped one. You see this right here, Doc?
Got it.
Yeah. I missed a pass, got hit, and screwed up my neck.
Yeah. Okay.
I just got this message from this viewer. Her name is Mrs. Iona. Because you said that you and I are talking early in the morning, and my excuse is, she goes, "Who are you talking to?" And I said, "Jake from State Farm."
Scott from Kailua. Yeah, no, it's I mean, I'm on a lot of it is just on these conference calls, and I'm on freaking Zoom calls where it's dark outside. And I told you the very, very first call I had to be on when I presented to the SEC is these two retired generals who I'm presenting this program with. They had us in sport coats. So it's 3 o'clock in the morning, and I'm sitting on a freaking Zoom with a blue blazer and a sport coat talking to them. And I was like, God damn.
But you had shorts, right? You had shorts. You had your underwear, right?
I had my freaking boxers on, man.
Boxers. Yeah.
Okay. I didn't even put my shorts on. I was just like, there's got to be more to this. But it's gone really, really well. And working on some other great program. Actually, right before I got on, I'm still working on the Navajo Nation. So we're going to have a big program, and we're going to be taking over the entire quarantine facilities, 2 different locations, and then all the testing in Navajo Nation. And that will be special to me, because of the relationship with our Pacific Island population and the unbelievably poor health conditions there. And so that one, I could be on the plane here fairly shortly to help start the first phases to help them. So I'm not going to desert our state. I'm going to be here for our state, but I'm certainly going to take advantage of working with groups and individuals who actually welcome the help that we could provide, instead of, being kind of in Hawaii's Department of Health most wanted list, so just wrong.
Wow. Charlie, any closing comments, Charles? That's a wonderful way to end this, though. I got to tell you, man, I'm so excited for SEC football. Oh, my God. Charles.
I just like to extend my deepest appreciation again to you, Doc. It's always a pleasure having you on. I think tonight it was more hard hitting because of the way you felt, because I know, like anything else, when we started having you on, we play safe, but it's gotten to the point where we got to do what we got to do, because it seems like to be falling on deaf ears. And you did the right thing. And later on, you go back and you look at the comments, and you'll see how many people just appreciate you. So I just want to tell you, thank you so much. To the viewers out there, thank you so much for joining us. 148, 150 shares tonight just by watching this. It's getting the word out. And also, my wife put out the email address for Senate President Ron Kochi. Send me a bunch of emails as well, because as you know, he got into a volleying of Scud missiles back and forth between the governor and himself, and it looks like he came out the winner on that one. So,
by a long shot. A long shot. Congratulations to Senator Kochi. I mean, I am a big fan, and I think the people of Kauai should really be pleased, because he's representing all of us well. Very, very happy with what he's done.
So, to all the viewers, thank you so much. I love you. Thank you for joining us, Mel.
Thank you, guys. Doc, thank you so much, man. I mean, you've always been there for us, for the people of Hawaii. It used to be Kauai. Now this show goes pretty much nationwide. And thank you so much for being there. Likewise, man, when I saw you in a press conference, I saw the edge. We had Josh Green on the show last week. And I told him, I said, you started off on fire, and there was a point where he became soft. The perception was Josh Green became soft, and he started to promote what the governor was trying to promote, being the opening of tourism, because the numbers were good. It looked like we were able to do it. And then I like having Josh back. I like having the old Josh back. And likewise, I just appreciate the people on our show, appreciate just the frankness, the honesty of our guests and ourselves. And you know, we're not here to scare anybody. We're here to provide facts. We're here to provide documentation. We're here to provide or to inform and educate. That's the theme of our show.
Yeah.
We could never do this without people like you, Doc. And you always answer the call, and we appreciate you so much. When you guys send your email to Senator Coach, you started off with a big mahalo.
Yeah.
Don't go barrage
Absolutely.
him with what you want him to do. Start off with the mahalo, because he stood up for all of us when he told Governor Ige to go to his room.
Yeah. Yeah.
Governor Ige told Senator Kochi in the letter that how dare the Senate go to the Department of Health office while Sarah Park and Bruce Anderson was in the governor's office. Well, if you watch the news, who accepted and escorted the Senate committee members in the building?
Sarah
Park. So she was not in the governor's office. And he said, so bottom line, say mahalo to Ron Kochi for standing up for not just his senators, for the people of our state. So I just want to make sure you make them the mahalo. Yeah.
And mahalo to you guys for your amazing honesty, the guests you guys have, and you're again, I mean, you guys, we are brothers, and I mean that. I want to hang out with you guys when COVID goes away, because we're just kind of cut off the same tree. Just look and tell the truth. That's all this is. It's about being honest with the people. Why can't our leadership get that? People will take the truth. They will listen. People for why will accept it. They know the truth when they see it. Just tell them the truth. But thank you guys for everything you do.
Thank you.
It's our pleasure, man. Our pleasure. Everybody, tomorrow is Sunday. We take a break on Sunday. We're actually trying to get Senator Kochi on Monday night. So bear with us. There's a house burning around here. I'm not joking. I told my wife, thought she was cooking. So I said, dude, is something burning? And now I hear the sirens. It's right around here. So I'm going to go check to see. It's got to be one of my neighbors' homes.
Take care, brother.
Pray for them, whoever they are. Tomorrow night, again, take a break. We'll see you guys back Monday night, 7 o'clock. Love you guys. God bless. Take care. Stay safe.
Take care.
Aloha.
See you guys. Take care. Aloha.